Let me check in here if we are. Ooh, here we go. We are live. Brilliant. All right. I'll just wait 1 or 2 minutes whilst a bunch of other people jump on to the live. Thank you for everyone who's tuning in. I know today is going to be super exciting because we are talking to some amazing, beautiful health practitioners. And I know this is a topic that people love to hear about. So we'll wait just like 1 or 2 more minutes until people realize that we've gone live in the group. And then we'll kick off. When we hit 20, we'll go. All right, guys. I know lots of you have, you're in between appointments, so I know we have to keep this like nice and quick and short, and so we will try to do that because I know a few of you got to run off. You're still in practice. We can see that all you guys still are.
That's right. So then have to give oxygen.
Okay. 25. So get going. Right. Welcome, guys. Welcome to today's interview. I love this because my background comes from where this space here. We are today talking about health practitioners in Healy. And as you know, we have such a diverse range of people that are attracted to Healy, but health practitioners in particular are attracted to Healy. So it's incredible that we have this beautiful lineup of people with us today. We have Catherine, we have Alison, we have Michelle, Jen, Mandy, and Dr. Ranger. It is beautiful that you guys have been able to join us and share with our community how health practitioners are really using Healy and why they're getting involved in Healy. So without further ado, I would really love to introduce every single one of you. And you know what? I know you guys are going to be way better at that than me to introduce yourselves. So let's kick off with Catherine. If Catherine, you would love to just share your background, and we'll go around for each of you guys, share your background, and then we'll kick off with the interview so the community can get to know who you guys are.
Thanks so much, Taryn. Yeah, super excited to be here today. So I'm a naturopath, nutritionist and a herbalist, and I've been working in the industry for over 10 years. And during that time, I've seen about 10,000 plus patients in my clinic. And I just love working with helping people feel well. Basically, that's my passion, to just help people work out what it is that's blocking them maybe from getting to that high level of health that they really want to achieve, and just actually, yeah, working with them on that journey to health. So that's a little bit about me.
Amazing. Thank you. Amazing. Thank you so much. And we'll hear heaps more from Catherine in a moment. Mandy, would you like to give us a little update on you and your background?
Yes, hi everyone, and thank you for having me. I'm a sound therapist here and energy healer on the Central Coast here, and I'm founder of Sensations, which is my little practice. I work from home. I do quite a few things. I also do nutrigenomics, which is nutrition via genes, and I have a lot of little tools for the toolbox. So Healy is amazing, and it's come in at the right time for me. So I actually used it for personal use as well. So yeah, that's basically what I do, is to help people on their holistic journey.
Amazing. And I bet all of you guys are here because you help people, right? Okay, Dr. Ranger, what's your specialty?
Okay. I research for in 91 stuff following the conventional food as medicine.
I think you might be funny. We can't quite hear you. Your connection.
I have I'm not muted.
No, you're not. No, maybe your Wi-Fi is unstable because you sound a little bit like an alien.
I see. No, maybe I go out. My in the office, maybe not.
All right, we'll come back to you in a moment.
Maybe.
Okay, Jen, how about you? Oh, you're muted.
Yes, I'm unmuted now, I believe. I was just about to make a comment that Dr. Ranga has a smart meter in his office, and perhaps that is sending those alien signals and interfering with his voice. So yeah, hi, my name is Jen Draper. So I've actually been a conventional doctor for over 20 years, and in the last year and a half, I've started a separate online holistic business within which I work as a health coach. And the Healy has been one of the selection of higher level healing tools that I use in my health coaching business, and I share amongst people from my personal experience. And it's been wonderful. It's been mind altering and life changing, and I love the business model, and I love the energy surrounding people who are naturally drawn to Healy, and it has helped me to come out of my shell and acknowledge the fact that I can actually be quite open on social media about having the dual role and balancing it. But when I'm in my clinic, I hide it under here.
Awesome, I love it. I love it. Okay, Alison, a little bit about you.
Hi everyone, I'm Alison and I'm really happy to be here. I am a holistic kinesiologist and clairvoyant medium, and I have been running my practice here on the Central Coast for over 10 years now and seen many clients and their families. And you know, as a kinesiologist and someone who deals with energy and frequency all the time, I believe that energy is everything, and I use many tools all the time, vibrational healing tools in my practice to raise people's energy and vibration. And you know, as a kinesiologist, I use muscle testing, but what better to have a device like the Healy that can just quickly scan instead of just muscle testing everything. And so yeah, it's definitely something that I've loved to get to use in my clinic, and yeah, excited to be here.
Pick your brain even more. Beautiful. And last but not least, we have Michelle. Michelle, would you like to?
Yeah. Hi. Thank you, everyone. Michelle, I am. I've been a naturopath for 25 years. I've been on the coast here for about 18 years practicing, but I've spent time traveling the world, spending time with African healers, teaching kinesiology and developing lots of tools. So yeah, I focus a lot on nutrition, diet, lifestyle, herbal medicine, homeopathy, the gamut. And I've done, you know, bioimpedance and bioresonance for, gosh, about 15, 16 years as well. So definitely the energetic side and the vibrational side has been a big part of it. So my journey has led into the DNA profiling though, the last few years, because I've just always wanted to find, you know, that deeper next level. And for me, that's where Healy is taking us to that next level of getting just deeper.
Incredible. Wow, what an incredible group of people we have here today. Like, you guys are just incredible. I just love that Healy attracts such beautiful people that come from that space. Of every single one of you said, you know, you're really here to help people, really here to help empower them on their journey as well to wellness. So it's yeah, it's beautiful for you guys to be able to do that. Now I think we've lost Dr. Ranga for a second, so I'm going to try and get him back. But before I do, I am going to jump over to Catherine, and I'm actually going to ask all of you, why did you jump into Healy? I mean, you guys are a health practitioner, you've got all your different modalities that you're using, different spaces that you come from. So why was Healy attractive to you from the perspective of a health practitioner? So Catherine, I'll throw that over to you, and I'll see if I can get Dr. Ranga back with us while you answer that for us. Thank you.
Lovely, thank you. Definitely, that's a great question. So why Healy? I have been using frequencies in my practice for over 10 years with bioresonance devices. So when Healy came along, I was very curious and a little bit skeptical, I must say, that this tiny little device could do so much, you know, that I was being told about it. So I thought, okay, well, I've just got to try it to see what this can do for my patients more than anything. That was what excited me. Like Jen showed hers, like that's how big it is. It's quite small. Whereas the device I use in my practice is large. It's like a big box and it sits on my desk. So it's not portable. I test people every day. And then if I have to work out what nutrition they need and what elements they need to support their health, I give those to those people. But that I won't see them again for often a month, at least, you know, 3 to 4 weeks to help their body adjust. Whereas what excites me about the Healy is they can use that Healy in their home, and they can actually be sending frequencies into their body on a daily balance to help balance their whole energetic field, their whole emotional state as well. And often a lot of people who are unwell, often that does affect their emotions. So, you know, it can lead to depression and anxiety. So they're big factors with any practitioner and for any person that most of us would see. And I find that the Healy can obviously support their whole energetic being on that emotional level as well. So it works on the physical level, which is what I was always looking at, but now we have that huge aspect of the emotional level as well, that we can help support their well-being. And I'm finding that in clinic, I'm already seeing such rapid shifts in patients in their well-being. And I think part of it obviously is that just that we're shifting some of those emotional factors that are quite hard to clear for a lot of people, but also there's so many elements to the Healy. I could keep talking forever, and I'm sure everyone else here can as well. So I'll let someone else share why Healy for them, but definitely I absolutely love it, and I use it every day in my clinic now. I scan people, like Alison said, it rapidly scans people. Even though I have my other scanning mechanism, I now use the Healy as well because I can see that it's giving me different information. So absolutely love it. You're muted.
I was just trying to get Dr. Ranger back on. Hopefully he's able to get in there. Yeah, awesome. What I love about Healy is it really looks at us as this whole person, like this whole being, doesn't it? And so you're able to like move those, you know, it's not just the physical, it's the emotional and how the emotional impacts the physical. So it's, yeah, it's incredible. All right, Alison, what about you? Why Healy for you?
Why Healy for me? Well, it's interesting because before I actually looked at it, I had a few people messaging me about it, and then my daughter's boss was talking about it, and it's like anything, the universe is trying to tell me something. And so when you've been told enough, then I finally had a look at it. And, you know, I was just around the time of all the lockdown and the isolation. And when Catherine told me, you know, I sat down and talked to Catherine here, and she explained to me a little bit more what it is. And you can actually, I was just blown away for it to have so many different programs on it. Like as a kinesiologist, I'm working with the body's organs, the meridians, clearing the chakras, right? You know, clearing all the chi in people's bodies all the time. And to be able to just run frequencies of bushflower essences or barflower essences or gem, you know, stuff that I have to stock my clinic with all the time. And the thought of that, you know, people don't have to go out and buy stuff like this, or, you know, I can just, while I'm balancing on the table, run some frequencies through them as well. I just thought, you know, this is just incredible. And I was just so excited. And so that's, I guess, why I got involved. And I just wanted to be able to, my thing is just like all about empowering my clients all the time, teaching them how to heal themselves, connect to their own inner wisdom, and know that healing doesn't have to be difficult. It can actually be really, really simple once your body receives the right information. So.
Incredible. And I'm going to just jump to my next question just for you for a moment, because you already slightly touched on it. How are you using it? You obviously said you are using it with in practice with people that are already coming to you. So you literally, you're just using it like when you're doing your kinesiology, you're doing that in conjunction, using Healy in conjunction? Yeah,
well, it's interesting because of the lockdown. I haven't been seeing clients in clinic at the moment. I've been seeing them over Zoom, so remotely. So the fact that, you know, I was introduced, because I do surrogate testing as a kinesiologist. There's a technique that I use, surrogate muscle testing, and I do distant healing as well as a clairvoyant, as a medium. Like I can be in, you know, a client can be in England and I can do a reading for them. So quantum energy and physics is just like, it's just natural for me. So to be able to, I've been actually, so, you know, remotely scanning my clients and then running the frequencies while I'm still on the session to them, testing up other stuff or talking about other stuff. So I'm just running those barflower essences or bushflower or whatever programs while I continue the session with them. So does that make sense?
Yeah, beautiful. And like I can see it fits with what you do so beautifully. It's like
to me it's just natural to work like that, you know.
already the way you're doing your practice, it just like slotted right in.
Yeah, and so that's the thing, you know, the moment we couldn't be in clinic seeing clients, this thing was introduced, came in, and it was just like a no-brainer to me. I was like, thank you, universe. So like, yeah.
Incredible. Thank you so much. All right, Jen, now you had the transition, or not the transition, but you're using them in conjunction, right? Of being a traditional doctor and a health coach. So looking, I guess, sometimes we often think doctors really just look at us as just kind of, flesh and bone and cells and things like that, but you're looking at it much more holistically. Why Healy for you?
Well, yes, that is exactly how doctors are trained to look at people. I mean, basically medical training teaches you how to make diagnoses. And I was listening to the Zoom last night with Marcus and Hong and Mike, and I loved the way that Hong was talking about these labels that we give. And that is exactly what a diagnosis is. It's a label which then helps the doctor who makes that diagnosis and the team, if there's that sort of holistic care, because that's how Western medicine looks at it. They look at it in the team, and then protocols that you go down. And I have always said, without actually understanding much more about it, that Western medicine does not have all the answers. I mean, we really, really need to look back and respect the traditions. And not that I know much about it, but I am learning more. And so Healy for me came along at a time when I was already making that transition to recognising that I needed to move into the health coaching sphere to be able to adopt and learn about things like Ayurvedic medicine and traditional Chinese medicine, and reading Bruce Lipton's The Biology of Belief. Suddenly I had this aha moment in terms of epigenetics, and it just put into perspective all of the medical training that I had, wherein if you can't make a diagnosis, then you call it an idiopathic, blah, blah, blah. And so the Healy, in terms of how we, when we're sharing with people and they want to know how it works, and we talk about the cell membrane voltage potential model by Drs. Becker and Nordenstrom, that makes so much sense to me. And I can explain and share that with people in terms of how in a diseased state, they move away from that healthy cell and away from that. And then when you read Bruce Lipton's book and it talks about the way to influence the cell membrane as being through frequencies, it's like, hello, it's opened up. And, I take my hat off to people who've been working with frequencies for many, many years, because I didn't have that awakening, but it was there within me. And the Healy, what it's done is it's actually opened me up to actually be vulnerable and able to just, feel the energy. It's really exciting. So I'm just stoked that I can actually work as a health coach with people on a personal, individual basis. And how, I don't know if you want me to answer the same question that Alison did about how I'm doing it now in my coaching practice, is that, my coaching practice is entirely online. So what I'm doing is connecting with people through that online presence. And I just show my personal story. I share how it's worked for me, and I share the difficulties that I have in wearing the two hats and balancing them and being aware of what you can say, but I'm not your doctor, but here I am. I'm a person who understands, with all of this medical training, you never lose that doctor hat, and that explanation of Western medicine and the learning that only gets you so far, to then have a high level healing tool which helps you to, address things that Western medicine may not be able to. For example, I just have two examples of how it has really worked for me in the clinic. And that is with people who, nothing's ever worked. They've always had side effects with like medications or supplements. So the Healy being energy medicine or energy healing, energy wellness promotion, that has been really successful for people. And one other little really, really cool thing is that it works incredibly well for guys with erectile dysfunction. So, and it is, when you look at bang for buck and cost outlays, 850 Australian dollars for a little Healy device that you can use over and over again. adds up much cheaper than all of the supplements or drugs or things like that that people may be using for that particular condition. So as an enhancement, and so that is my personal experience, that I have had that, and you can kind of use your imagination as how I know well about that. So yeah, so that's what I love about Healy and using it in my business. So it looks like Taryn's just frozen from my end.
Yeah.
It's got Taryn frozen. Bali internet. Yeah.
Maybe if Mandy wants to share, is that all right?
Yeah. Yeah. I will. Yeah, I'll just go ahead and say why. It's for my personal journey. I have been to see Catherine, as Catherine was saying, her big machine that she has, and if it wasn't for that machine, I wouldn't have known what was going on with my body so quickly as well. I had a systemic bacteria growing in my body that was just debilitating me, and I'm still on my healing journey, and I probably will always be on the healing journey, but I just feel amazing now. So, and that's my why usually, and I've always really loved energy and always knew that energy was, because we are all energy, and energy is the way of the future, energy healing, as well as all your holistic, all the other tools you can use, so with nutrition and other things. So yeah, that's basically my why.
Just on that, Mandy, can you share with us how you've been using it while we've been in lockdown, been doing scans?
Oh, yep, I have been doing scans remotely as well. Karen's back. And also, because obviously can't see, so usually just remotely, and for friends as well, and also the furry animals that we have that are really special in our lives. So I've been doing quite a bit of remote scanning, and it's just amazing, and it's helping. I mean, to help people that way as well, without even sort of connecting with them personally, is amazing in itself all around the world. So
awesome. I obviously dropped out. So, thank you, Mandy, for sharing. I picked up that you also use it with animals. Yeah, that's what
yes.
I just jumped in back.
Yes.
Incredible.
Yeah.
Amazing. Wow. I left off where we were talking about maybe I blushed when Jen was talking about how she knew about its effectiveness in certain areas, and jumped right back in where we're using it with pets. Okay, so Dr. Ranga, I know that you've had to jump into your car to obviously get some good Wi-Fi where you are. So we might just kick off with who you are a little bit. So maybe just a little bit of your background, because we couldn't quite hear when you're first introducing yourself, and then why and how you're using Healy. So why you wanted to get involved with it, and how you're using it in your practice. Oh, and you're on mute.
Can you hear me now?
Perfect.
Oh, fantastic. I'm in the car park, yet the reception seems to be better than my office. So anyway, my background is in food and nutritional science and microbiology, biotechnology, and biochemistry. So I did my PhD in 1989, finished in 89, and then I worked as a research scientist for another 3 years at University of Wisconsin. So at the end of that time, I was diagnosed with lymphoma, and I decided not to follow the conventional medicine because I've been doing meditation for a long time. I felt like it wasn't looking at the cause. It was just looking at the symptom and removing the symptoms. So I decided to use food as medicine, change my diet completely. And then rest was doing Reiki, because I was taught by a very special teacher in 1991, a Japanese monk who was passing through. So I used that method and meditation, and within 2 months, the tumor regressed, and I decided to change my work from academic research to working with people. So around that time, I was able to come to Australia and started clinical practice and a health food store. And for 29 years, I've been doing that. And I always trial and test different new products, unique products or devices. I'm always interested in diagnostic tools and treatment tools. So I was introduced to Healy about 2 years ago, and I used it, and I felt it did a lot of good for me because I'm sensitive to energy. I knew how it worked. But for some reason or the other, I had other stuff come in and other instruments testing, and I fell into the background. And until about a few months ago, when Leanne came over to my practice and demonstrated how the resonance worked, the analyze.
Oh, you've gone on mute.
Hey.
Oh, yeah, you're back.
Hello?
Yeah, you're back.
Yeah, so I just got a call coming in. I had to cancel that. So anyway, she showed me how it worked, and it was fantastic. But that day I had a back pain. I had like kind of sciatica pain. And she did a treatment, did the resonance. It came up as I had allergies, small intestine, and bladder, and which was quite correct. And I decided she did a treatment with the bladder, and within 30 minutes, the pain was 90% gone. And I went home and redid the treatment, and it was completely gone by next day and never came back. So I haven't used in my clinical practice, but only recently I'm starting to use it. And one of the first really amazing responses was with my wife. She started having a bleeding issue like spotting. And I called Leanne and I texted Leanne, and she was very kind to do a distant assessment and treatment. And by next day it had stopped and is completely gone now. So, and I looked at the remedies recommended by the program, which was all the 3 homeopathic remedies were actually involved with bleeding and stopping bleeding. So it was quite, yeah, it was fantastic. So I'm very happy to be now I use it on myself now every day. And it's been fantastic. And because I work with energy a lot, this is exactly, something that I love to work on myself. And now I'm going to use for my treatment, for my patients.
Amazing. I think you're frozen again, but I think you said you're going to use more.
Okay. So that's what the main reason is that because it's very effective, and I work with energy a lot. So hope you can still hear me.
Yeah, that's amazing. Thank you so much. And I know you're a very, very respected doctor in your space. So it's an absolute honor to be able to have you here with us and in this space, and partnering with Healy as well. So thank you very much.
You're welcome. Thank you for inviting me.
Okay, Michelle. Last but not least, Michelle.
Okay, here I am. I have a little funny story about how I was introduced to Healy. I was actually speaking with a psychic medium. It was on the Sunday, and she just all of a sudden started trancing and looked at me and she said, "You're about to be introduced to something that is going to take you to a level of healing you just cannot possibly understand at this moment." She said, "But you're going to balk and you're going to say no because you don't like the marketing side of it." And she said, "I need you to know now, you need to stop and look at it and have a try." She said, "I have no idea what's coming your way, but something big is coming." And literally then 2 days later, Catherine rings me, "You've got to see this quantum device that I've got." And I went, okay, we'll come and have a look. So yeah, my first scan with Catherine was spot on. It was so accurate. And then the treatment, it was amazing. The next day I woke up and went, can't possibly be true. But yeah, so I was pretty much convinced. And then 2 days later, I'd ordered it and it had arrived 3 days later. I'd barely unpacked it. And it was my next day in clinic. And the first client that sat down in the chair, she said to me, "I've been told by my people upstairs that you've got an amazing device that's going to help me." And I just went, I haven't even unpacked it. So here I am in clinic, unpacking it, hooking her up. And she was actually, she's very dear. She's extremely EMF sensitive. So I even said to her, "I don't think this is what you're talking about, because, when you're here, I can't even have Wi-Fi on. I have to turn that off. I have to turn the Bluetooth off for her to be able to sit in the room comfortably without getting headaches or, being zapped." And she said, no, I've been told I have to push through. So it was from that moment we did, a balance on her, and we've not looked back. So her development has been incredible. So yeah, I just had that validation from, you know, from the day dot that it was just the right path to go.
Wow. So, what an amazing, like, just guided. Look, boom, here it is.
Yeah, it was crazy. But yeah, and you know, for me, I've just been thinking, since I've been doing so much work with the genetics, that's, you know, at some point you think when you start learning something and you get a little bit obsessed about it and you think that's the answer to everything, and then you have to go full circle and realize it's not necessarily the answer. There's never only one answer to anything. So you've got to come back to a point of balance. So I'd gone to that obsessive level with the genetics and came back and realized it's not always going to be the answer. There's so many other things involved in health. But I just knew I needed to get deeper. And going back to the psychic, you know, she did say to me that whatever's coming your way, you're actually going to be able to use it at a quantum level with the genetic side of things. So, and then just serendipitously, I was listening to somebody just speaking online, and it was just that one little comment that just where you have your aha moment, where he mentioned that we've now discovered inside the DNA helix this shaft of water. And his comment was, if we could just tap into the vibrational essence of that water, you can change epigenetic expression. And that was my moment. I went, oh, that's where I'm going.
Wow. Just so incredible. I mean, I know, like, we're in here in quantum evolution, right? And the reason I named it that is I really feel like we are evolving at this quantum rate. And so just, I mean, imagine being able to tap into that and the kind of rapid evolution we would see in ourselves and in healing and wellness, and you're just as human being.
Yeah, I mean, if we look at the fact that we only understand, you know, about 1% of our DNA, and there's that 99%, that's a huge amount that could be all this activation that needs to happen. And that's this new dimension we're moving into, all the light codes that need to be activated. And I just think it's the right time, right place.
Yeah, how beautiful, how beautiful. Okay, you know, actually that leads me into another question, I guess, that I can that I would love to ask. You know, we are here in quantum evolution, and I would love to know from you guys, how do you see the role of a health practitioner evolving? Like, how do you see that? I mean, we've already actually even heard from a couple of people who talk about, okay, we're in a space right now where it's an unusual space for us in the world. We're being isolated from each other. You haven't been able to have that kind of one-on-one interaction that you've been able to have before. So there's obviously been that evolution that you could change your business model really quite quickly with a lot of this remote healing and remote sessions, etc. But even further than that, how do you see health practitioners evolving, and maybe even how do you see Healy being part of that? Oh, let me see. Who do I pick? Who do I pick to go with this? Jen.
Well, it's that's a really great question, because I would love to do myself out of a job in terms of being a reactionary doctor who, you know, this is the other job where people come to me and then there's this sort of concept of dependence, and you know, you really like I'm very fortunate that in my day job, because I call my coaching job my night job, this is my day job, and the balance, yeah, there's a bit of crossover, but just in terms of time commitment, etc. But people who, you know, come to me will have this sort of almost like dependence on this model that I was alluding to before about this labels and diagnoses and this sort of thing. And, you know, with that conventional medical training where doctors are coming from in that space, where, you know, it's a pill for every ill, or if in doubt, cut it out. You know, that's that sort of divergent path, and it just doesn't leave any room for people doing what the other sort of larger percentage of people who do come to me, because that's a really small minority in my day job, fortunately, because I've kind of selected out people who respect the fact that I have that as my mantra. You know, I know Western medicine doesn't have all the answers, so I'm continuously kind of searching for them. And I've been, over the last few years, I've actually achieved a certification in anti-aging medicine. and also undergone a personal body transformation myself by challenging a lot of those ideas that have been indoctrinated in through me as a health practitioner. And so I think that as a practitioner, to be changing in how I see it evolving is that, you know, we are going to be respected in the community if we don't keep ourselves in this insular little thing. Like, I remember being interviewed by a researcher probably about 10 years ago now, and he was asking me as a general practitioner, what is your view of complementary and alternative medicine? You know, taking research amongst general practitioners. And my view back then was so narrow compared with how it is now. And I think that evolution is something that health practitioners need to be prepared to do, and I'm talking conventional health practitioners as well. And if health practitioners in the conventional model just stay with believing only what they are getting through their education through the free, vested interest funded education things without actually spending their own money and pursuing other educational routes, like you know, my certification in anti-aging medicine came through A5M. There's ACNAM. I mean, in Australia, we are really, really so blessed that there are so many different organisations, and they don't restrict their teaching to just doctors. They broaden it out to other health practitioners, and I think that that's really the way that health practitioners ideally can evolve, so that conventional doctors can actually recognise that it is okay to refer outside of that conventional model, because people are demanding it. That is where the market is going. You know, people will come to you and they have used Dr. Google. And I mean, I do love my little coffee cup that I haven't said, please do not confuse your Google search with my medical degree. But I think a doctor who refuses to acknowledge that the patients are going to come with their research and, you know, their inquisitive mind has just got blinkers on and really is going to be left behind the times. So I see, you know, my being able to work successfully as an integrative general practitioner within those confines, but yet then with doing other things that are just kind of so outside the scope as, you know, having the second job as a health coach, that has helped me to make that evolutionary transition. But my holding space is that conventional medicine is going to have to keep up with what is demanded by the general population as a consciousness, our level of vibration raises up and we all become aware that, you know, that conventional model of medicine does not answer everything, and that we really do need to be open-minded.
Yeah. Do you see, I mean, obviously there will be the market, as anything in marketing, but the market will drive certain changes within an industry. But do you see a lot of conventional doctors being open to looking at these different modalities and these maybe more alternative modalities? Are you noticing that from that perspective, that they're becoming more open to this, or are they still really like, no, that's like crazy woo-woo stuff. This is the real stuff here. Are you noticing that?
I am noticing it, but I think they're keeping it under the radar because of the fear. And, you know, when we talk about the fear, like the situation that we're in at the moment is a prime example of the fear. And a simple concept that has really helped me through this period of time is that in my heart, there's only room for either fear or love. And if I want to banish the fear, then I've just got to open it up to love. And I think that in terms of conventional doctors, if they undertake, you know, this was what I was going to say, I really feel that as a successful practitioner, you really need to kind of lead by example and be prepared that you are undergoing your own journey. And, you know, this, like what Hong was saying last night about, you know, I'm really, really well, I'm really healthy, except I have cancer, or except I have diabetes, you know, these little labels that are there. So I think that sometimes can be very fear-provoking for conventional practitioners to actually consider that all of their training, that, you know, the inconsistencies within it and the quandaries that they come up against, that there actually could be another way which is not within their realms of their existing training, and then they really need to look outside the box and perhaps sometimes actually pay for education, which a lot of conventional doctors are not willing to do. So I think until that shifts, and the other thing is evidence, and a really important thing is that, you know, in the day and age of Google and being able to go and research, you know, what you come up against is you come up against testimonials. When you look for evidence in the sense of conventional medicine, you're really looking for these randomized controlled trials, and with them you've always got to look and see who is the funder, and unless there's people who are going to be willing to fund and, you know, therefore support the level of evidence that is required until it is accepted by conventional medicine, I think there is going to be forever that great divide. So certainly in my business, what I'm looking at doing is looking at creating some evidence within there by requesting the people that come onto my online service to see me as a health coach to actually complete a little standardized and validated, well-studied medical symptom questionnaire, toxicity, by Dr. Mark Hyman of the Cleveland Clinic, so a very well-respected functional doctor in the United States. Completing that and having that as their self-assessment tool while they then implement different higher level healing tools, so that they can, and then actually getting consent to utilize that in our database, so we can start creating the evidence to try and shift some of my more stuck in their way conventional colleagues. So that's my
incredible. And I know we are attracting so many incredible doctors and other health practitioners as well, and the more we attract those, the more we will start to build up more and more evidence around that, so we can kind of, you know, so the divide isn't so big anymore. It's you know, much less divide within there. So it's amazing, and I really honor the fact that you're taking that journey from that space and more into this space, and really trying to help awaken more of those doctors and practitioners in that space. So thank you. Okay, Catherine. So we didn't actually get to hear how you use it in practice. So maybe you want to go into that, but then also how you see this, how you see health practitioners evolving, or even within your space, how you could see practitioners evolving.
I just think this is so exciting, because as a practitioner, we all want people to be well. That's our objective. So to me, using this to give the patients a tool that they can use themselves to empower them to start really raising their health to that next level. So as a practitioner, like some people might be worried, that's one objection I did come up with, are you going to do yourself out of a job? So I don't see this as any way at all will do that. If anything, to me, it's exciting that we can give people a tool now to really help themselves get well faster. So that's what I love about this, and the fact, like Jen was saying, we need to be open to all these new technologies that are coming through. So if we're not doing that, people will find out about it anyway. And so I think as a practitioner, I love to be able to guide my patients, say, hey, this is going to help you so much. We can scan them, we can then give them that list of what to do in their own home with the Healy. And also just that whole social selling background to it, that there is that other element of income as well, which I find super exciting. So and then that can also be passed on to any of those people that we're seeing. Any patient, anybody that has a Healy can have that opportunity to actually support themselves financially. So instead of having to come to me forever and ever to get well, I find that it's exciting that eventually they'll feel well enough that they can be able to use their Healy in their own home. That's what excites me, that they won't have to be coming back to me for the rest of their life. I want them to be able to have that power themselves, to know how to get well and to stay at that level of vitality, because that's, you know, you can't even have that creativity, any objective of what they want to do in their life if they're not feeling well. So that's what excites me. You can get them to that level straight away. They can go, okay, now what I really want to do is this. They're not in that sickness model anymore. That's what excites me most about this. So we're empowering people and we're raising that vibe and consciousness of everybody at the same time. Absolutely love the Healy. So thank you, Taryn. You're frozen again. Oh, there you are.
Yeah. Oh, sorry. My Bali internet's unfortunately not that stable, but it's incredible when we even, you know, we were listening to Hong last night, and she was saying 5,000 years ago, the first healthcare system was that doctors were not paid if anyone was sick. So their job was to keep that group or that village or the society well, and if people got sick, they didn't get paid. And so I think that we have it completely flipped over the other way now, right? It's almost like we try and get, you know, if they're sick, the more sick they are, the more help they need from us, the more they're going to get paid. It's beautiful that with this, we're really kind of, you know, flipping it back again where we were 5,000 years ago, and flipping it back again to actually using this model, especially for health practitioners. And I know most practitioners get into this because they're just really passionate about helping people and about getting people into that state of wellness and well-being all the time, to be able to flip that model so that you're paid well when you just have a community of people that are healthy and well and optimizing their wellness. I mean, I think that's such a beautiful flip, and that's what I would love to see as the evolution of where health practitioners are going. So maybe Alison, do you want to talk a little bit about where you see the evolution of health practitioners?
Well, I think what Catherine shared and what you've just shared is just, you know, spot on and exactly where I am with it all. I know, as someone who suffered from chronic autoimmune disease and fibromyalgia and chronic fatigue for 6 long years in my 30s, and not one single doctor, not one single blood test scan could tell me what was wrong with me. Everything showed up, nothing's wrong with you, all your levels are normal, like everything. It was so debilitating, disempowering to have, you know, who I respected, doctors and all this. It's like, I wish they could have told me what was wrong with me. Like, wish they could. But for whatever reason, you know, their ability to test me or diagnose me was just, not happening. So I know what it feels like to suffer for years and years and years. And just to be able to have like the technology to be able to help people quicker so they don't get, have to suffer. That's all I care about in my practice. And whatever way that happens, like, I'm all for it.
Cool. Beautiful. Okay, now I know we've got 10 minutes left, because I know all of you guys are going to rush off and see, most of you guys are going to rush off and see patients as well. I'm just going to actually put this out to all of you, so you can kind of raise your hand, whoever would like to answer this question. So, health practitioner to health practitioner, how would you explain Healy? Anyone? Or Michelle?
I guess, yeah, okay. I'm trying to think how have I, because I work with a lot of practitioners. I'm in an environment where we do network a lot. Everyone has a different level of understanding of energy fields and tools and devices. So I try to get from whoever I'm talking to where their level of understanding is and bring the conversation of Healy into that level. So if I'm speaking with someone who's, a chiro or an osteopath, I talk about, well, the TENS machine. And I go, well, this is nothing like the TENS machine. It's a lot better. So you actually anchor it into something that they're aware of so that they can then draw their knowledge and start to build on their knowledge. I have another colleague who is very linear, very scientific in his thought, and he had an experience with Healy and understood the effect. But then when you start talking about energetic healing, he just switched off. And I said, well, you understand quantum physics. I know you've studied quantum physics, and I know you understand string theory. And the minute I said string theory, he went, oh, okay, I get it. So it's just a matter of trying to find that point where someone can connect theoretically or, energetically to the Healy. So that's been my experience with talking to other practitioners. Just find that level of commonality, I guess.
Yeah. I mean, I personally find I just put it on them. I just put it on them.
I mean, the experience for itself. So, and that's why I just really briefly in my clinic, I've been using it for 4 months, and I've got to the point where I'm getting phone calls from my clients' physios, their urologists, even an orthopedic surgeon who put off surgery for 6 months. It was due this week and he said, I don't need to do this surgery. We're going to put it off. And they're saying, what are you doing? So that's been really exciting to actually, and that's what's opening their eyes. And yeah, so it's just a matter of experience. So what I'm now doing is actually just offering a lot of free service. And that's what I'm really grateful for, that I'm in a position now where I can spend the majority of my time just saying, just come and have an experience. I just want to share it with you. Don't worry. And, you know, my reception here, she knows it's the freebie Healy session.
Awesome. Amazing. Sharing. Catherine, how do you explain it, I guess, to health practitioners? I know you were really one of the first, if you like, in Australia to have it, be sharing it amongst that community. So how have you been sharing it, and how do you explain it to health practitioners?
Okay, I just basically am so excited. I say to them, look, just try it, like you said, definitely. But also, I like to just take it back to the basics of this is backed on science. Like, we know that it's quantum physics. We know that there's been science about all these frequencies for hundreds of, several hundred years now. There's frequencies that are being used by practitioners in business for, decades. And I use some examples of well-known practitioners, obviously Nina, who's part of Healy, but also some of the ones in America. And just say, look, we know that these frequencies are tried and tested. We know that they work. But definitely experience it for yourself. And I guess having that confidence myself, knowing that I've worked with frequencies for 10 years, and just my excitement, I just say to people, look, you just have to look at this, because if you don't, someone else is going to tell, your patient is going to come in with a Healy anyway. So why don't you find out about it first, and then you can share it with your patient. So that's the approach I'm taking. And that, as Michelle said, and Jen, like, we're all here, we're all practitioners, Alison, Mandy, we know it works. So use our belief if you're not 100% sure at the moment, but definitely try it. And then obviously connect back to whoever shared it with you. So that's the beauty of this social selling, that you always have someone to talk to who's already using the Healy. So if Alison wasn't 100% confident, I could say to her, well, hey, have them chat to me. So you've got that backup and that support. And like Michelle said, then you have that ability to test people for free, because we are being, got that other source of income as well. So I just believe everyone's going to end up with a Healy in their house. And so the sooner we do that, the better, and the faster people are going to feel that higher vibe and that love, that high vibration. That's what you need to get out of fear. I loved how Jen said that. We have to be in that love frequency, and that's the Healy helps us, because it's got frequencies that support our whole nervous system and our mental state. So there's just too many exciting things to talk about.
It gets like, all of these interviews, no matter whether it's talking with women or talking with more spiritual community, or the biohackers, or the fitness lovers, or just everyday people, like, they just can't stop talking about it and how incredible it is. So thank you for sharing that. Mandy, how do you share it? I'd love to know how you share it.
Well, pretty much how everyone else has done it, but I'm more of a so I'm not charging anyone. I'm actually free, doing free ones. Just want to share it. I want to share it with everyone, because I just know that it's amazing and it can help on so many levels. With subconsciously as well, with a lot of deep emotions. That's where I come from, the emotional side. Getting right into the blueprint, because there's a lot of people, you have to peel away the onions. It's like it's a layer, so you have to peel it away in a way, so that you can just hopefully come to that balance in yourself, in your inner self. So that's basically how I like to share, and I like to deal with a lot of people with emotional issues too. So that's my heart. That's where my heart lies.
Yeah, awesome. So you just put it on them and let them have that experience, see how it unlocks.
Exactly. Yes.
Yeah, amazing.
Let them feel it, because that's nothing better than letting them actually put it on them and let them see for themselves what it's doing, and it just does that.
I mean, I've shared this before as well, but when I was fortunate enough to go to the castle where they develop all the R&D for Time Waver and for Healy as well, and I got to meet one of the lead medical doctors who's also a quantum physicist, and I was like, what's the secret? Like, tell me the deep secret of how you could really, you know, like, give me some pearls of wisdom. And he was like, you just put it on people. That was it. He's like, I don't know anything more effective than just putting it on people. So he's like, I can tell you this, I can tell you that, but he's like, it's just like a phone, I could tell you how the integral inside of it work and how this technology works and how that interacts with this and interacts with this and brings you that information to the phone. But he's like, but as soon as you use the phone, you realize what it does and what it does for your life. And he's like, so just put it on people and let them experience it. And that is really the best way to share it. I mean, you don't need to be a medical practitioner. You don't need to be a doctor. You don't need to come from that space. You just need to know how to say, hey, would you like to give this a go? And it's just as effective as I think anything else out there. And so maybe
also being a massive empath, it is great. The protection is great. That's what I live on. Helps me a lot.
I know a lot of healers and people that are in that space of service, they give so much of themselves. And to be able to have for themselves personally now something where they can just sit there and receive. I know whether it's been talking to doctors or health practitioners or healers or anything like that, or energy healers, they're like, oh, I get to actually just sit here and receive. And then now you can give from a space of your cup being full. Now you can give from that space of like you're overflowing with energy rather than depleted with energy. And so that's I think a really nice space as well. All right, lastly but not least, Jen, how do you share it with like doctors and like maybe even conventional doctors? I don't know if you have even shared it in that space, but what would be your tips if you were trying to share it in that space?
Yeah, that's a really hard one. As I said, there's a lot of fear there. So they do want to know, what the regulations are, etc. So I'm certainly across all of that and making sure that if there's any changes in that, then I'm up to date. And so really, really excited once there's actually the word Healy in the Therapeutics Goods Administration as a medical device. I know that there is a listing there for an analgesic TENS machine made by Time Waver. So I just want that explicitly to say Healy, and then it will be so much easier. But with regards to other health practitioners, I think you've hit the nail on the head when you're talking about personal experience and really, where I'm coming from with my passion being to lead health practitioners in becoming examples through their own self-development. It's just such a wonderful tool to enable that. So I agree with what you've said about just share the experience and just get together and have a coffee. But at this stage, no, I have only shared the Healy with my and I have to say that I am kind of, I guess, amongst the conventional doctors. They do kind of look at me, and because I shrank myself from a size 26 to a size 14, they kind of look at me and go, what the, so I used to be an obese medicated individual, and now I'm a normal sized person, so who hasn't taken any medication for over 7 or 8 years, and that's been through jumping through all of these hoops and challenging those paradigms and things. So they kind of treat me with a little bit of mistrust. So it's definitely staying under the clothing when it comes to other health practitioners, unless they kind of draw me aside and say, can you share some secrets? And then I will do that. But
Can I just say that's what I love about this Healy? It's the tool, again, like it's all about bridging for me Eastern and Western medicine, bringing this gap closer together that we can work together. It's this amazing device that can tick all the boxes for the science world and the Western world, but it also encompasses so much of the complementary and Eastern world as well. So it was just a no-brainer for me to bring that gap close together for people so we can work together.
Absolutely. And ultimately, that's where the real evolution is when we merge, become one, whether it's in conventional medicine and alternative, we merge, we become one. Whether it's Eastern and Western, we merge, we become one. That's when the real evolution is, because there's little bits of gaps in all of them, right? And so we're able then to really fill those gaps up when we come from that space, which is Yeah. Well, I know we have now run out of time, and I know all of you guys are very busy practitioners, and you've all told me you've got to get off it in an hour. So thank you so much, so much for sharing all this wisdom. This certainly will not be the last that we have about the health practitioners of Healy. I am, very overjoyed that we have such beautiful people and beautiful practitioners and beautiful human souls, more than anything, that are on this journey with us, lighting up the way for more people and sharing this incredible gift with the world. Thank you so much for sharing your time today with us and for sharing your knowledge and wisdom with us in how you're using Healy, why you love it, why you're bringing it to the world. I honor every single one of you. Thank you so much. And thank you everyone who tuned in and listened, and definitely watch. Tag people, tag your doctor friends, tag your health practitioner friends, anyone that's in this space, and watch this. And as I said, it certainly won't be the last one. I look forward to hearing from you guys again, and I actually look forward to individually getting to know more of you guys as well. So you've all got incredible journeys and stories. So thank you so much for this.
Thank you.
Thank you so much, Taryn.
Thank you.